Hi, welcome to From the Hill. This is State Representative Jim Arcero coming at you from Zoom from my renovated dining room as we've moving forward on day 45 of the pandemic and the stay-at-home order. What I've tried to do in the last 35 or 40 or so odd days is get a perspective from individuals on the front lines dealing with the pandemic, and also provide resources for individuals throughout the district and throughout social media of how we can kind of get through this together. Today I have President Christine Schuster, who's the president of Emerson Hospital, and just going to have a conversation with Christine today and ask some questions about what people in the region should know about, what your experiences have been, and what your perspective is. Thank you very much for being here, President Schuster. I appreciate it.
So I'm really excited, and thanks, Representative Arcero. First of all, clearly you care about our community and the communities you serve. You've kept folks in touch through your social media pages, and I feel very informed about all the things that you've been doing on the Hill to make sure that hospitals and frontline staff are protected and have the things that they need to do their job. So thank you. While I've been caring for patients, I know you've been caring for the hospital and making sure that we're well represented up on the Hill.
Well, thank you. Well, certainly we're all in this together. It is unsettling times. It's unprecedented times. What's your perspective? How many years now have you been the president of Emerson?
So I'm a nurse, and I've got an MBA from the University of Chicago. So I've been doing CEO work of hospitals for about 23 years, and I've been at Emerson, it'll be 16 years July 1st. So this was my community long before I became the CEO. So I feel like a real responsibility to care for my family, my friends. All my kids went to school in the community, so really taking care of this community. So we started out 44 days ago. Once this began to hit, we brought up a command center, and Emerson trains regularly with the surrounding towns for emergency preparedness. So we were ready to go. The challenge became making sure that we had the tools we need to fight this crisis. So ventilators, personal protective equipment, and very early on, we were able to secure some of the pipelines to get those things. A real shout out to Representative Lori Trahan, who was very instrumental in helping us get some vents, and she was by last week dropping off some thank you lunch to our staff. But together, we were able to pull together so that my staff had everything that they needed so that they could take care of patients. So Emerson was ahead in just about every area. We shut down who could get into the hospital. We ensured, most importantly, that our staff had the personal protective equipment they needed so they could take care of patients. So they have everything from shields to masks to scrubs that they wear so they don't have to wear their regular work clothes home. So, and the ventilators, we set up a second intensive care unit so we could care for patients. So we've been busy making sure that we can take care of our community.
Yeah, absolutely. It's interesting, and I think you kind of saw this too, President Schuster. The first few weeks when the order went down, the stay-home order, I guess the first week or so, I have Lowell General Hospital as well in my district, and we've been in contact, of course, with both Lowell General and Circle Health, as well as your hospital. But it seemed like the first few weeks were like the wild, wild west when it came to getting PPEs and ventilators. The governor, of course, because we're all learning on the fly, so is the governor in so many ways, with facts on the ground and trying to put those together and protect people and to make sure that we're following CDC guidelines of the pandemic. But certainly at first, before there was the vendor link, I mean, it's, I have a friend's brother's sister who has a business in California and we'll connect you with him. It really worked by word of mouth, by relationship, to get the PPEs you needed, to get the ventilators you needed, to get equipment. A little bit about that.
It was a frenetic time because this came upon us very quickly.
Mhm.
And it required that we got ready like in 0 to 60. So there wasn't a lot of prep time. And you're right. The first thing we needed to do was to nail down our secure lines of personal protective equipment. And the models that were coming out said you needed so many vents. Well, on a normal day, we may run 14 to 15 vents, but all of a sudden the model said I needed 50.
Wow.
And so through some very generous donors here in Concord, we were able to purchase some vents with the help again of Congresswoman Trahan. The protective equipment was a lot more difficult. And we have a very deep relationship with Partners Healthcare.
Mhm.
So they have been unbelievably supportive of making sure that we had what we needed. The biggest challenge was that the guidelines changed almost daily.
Mm.
So one day you're wearing a surgical mask that goes around your ears. Another day it's an N95 mask with a face shield. But we have really good, we found that communication was important. And so making sure that we communicated twice a day with our staff so that we could stay up with the latest and the greatest guidelines really made a difference. And the other thing is nothing like a good crisis to bring people together. So throughout the hospital community and under the leadership of Steve Walsh from the Mass Hospital Association, all the hospitals are working together. In fact, even up into Southern New Hampshire.
Mhm.
And can I help you here? I have some openings in my unit here. And, you know, in the end, I love healthcare because of the people that are in it. And their sole goal is to care for the community the way we do. So it's actually gotten a little less crazy in the last 3 or 4 weeks once we got our systems and processes down. But now it feels a little bit like Groundhog Day. So we get up and we do the same thing, and we're very eager to get back into doing the work that we usually do in caring for our patients. But we also know that it's important to follow our governor's advice about not getting back into our old ways too soon.
Absolutely. I mean, that's the scary thing. You know, we've heard Governor Cuomo, we've heard, Governor Baker talk a little bit about all the hard work that we've done, all the messaging, all the resources that we've shared, we've provided. We've worked with the federal government, with our local government, to make sure people are safe and that we move back into our new reality ultimately, correctly, and not take 10 steps backwards by doing it too fast.
And you're absolutely right about that. And I do want to say to folks, um, everyone seems to think that I should be afraid to go to the hospital now. But truly, one of the safest places you can be right now is the hospital, because we are protected from head to toe. Hospitals are very different now. You just can't walk in. Everyone is checked on the way in, asked about symptoms, got to Purell your hands, and wear a face mask. So we are very careful. We separate COVID-19 positive patients from non-positive patients. And I think sometimes people are afraid to go to the hospital now, that you might stay at home and not feel well or not have something checked because you're afraid. I'll tell people you should go to the hospital if you don't feel right. If something isn't right in your body, and you usually know it, you have chest pain, pain in your side, something aches in your body, don't be afraid to go to the hospital. Hospitals now have this down. And so we'll separate you, we'll protect you. There's a lot of testing that's done outside of the hospital proper. So we ensure that we're not mixing COVID positive and non-COVID patients. But many people have put seeking care off while we've been in this pandemic crisis, but I urge you now not to do that. And I say that to you more as a registered nurse than as a hospital CEO.
Yeah, and you make a great point. The governor reiterated that point the last few days. He's going to do it again today at his press conference. And just my question to you is initially information changes so quickly, right? And so in the last 45 days or so, every day is a little bit different. And for instance, the nursing homes that myself and Senator Eldridge had filed legislation to put additional DPH oversight on the nursing homes in Massachusetts because of communication issues, because there was some discrepancy on testing. And I think it was just a week and a half ago, the National Guard expanded their mobile nursing program to allow nursing homes to have their own test kits. Well, guess what? They weren't all conducting the test kits appropriately, and they weren't using them for their staff. So now the governor actually retracted the test kits and now has the mobile National Guard units going out to test both employees as well as the residents. And there was a little bit of a problem for the first few weeks.
And we saw that because a number of those patients ended up in our emergency department. So in our community, what we've tried to do is to help supply personal protective equipment to some of the skilled nursing facilities. We also have given out cloth masks. The Emerson Hospital Auxiliary made over 10,000 cloth masks. And so we've given those out because it's one thing to be able to get access to masks at work. Once you go back into the community, we also wanted to have our healthcare staff be good leaders and role models in the community for wearing the masks when they're there. At this point, I truly think you have a greater risk of catching COVID-19 in the grocery store than you do in the hospital.
Wow.
You know, we've taken every precaution. And, you know, my advice to folks truly is, this is serious. If you look at the statistics and the numbers of positive cases and sadly the deaths, you really have to follow some simple guidelines. You know, washing your hands, and I sing happy birthday every time I do that, and I'm about 3,200 years old right now, but wash your hands.
The 30 Mississippis, so
exactly.
That's right.
And so, you know, with soap and water, if you don't have soap and water available, use hand sanitizer. Social distance, 6 feet. So think about a hockey stick. Stay that far apart from folks. And when you're out, wear a mask, because this virus is transmitted by droplets. So if you're outside, even taking a walk, and someone was taking a jog before you, those droplets hang in the air about 3 hours.
Wow.
So you want to make sure you're not in front or behind someone who may have had this. So wear a mask when you're outside, protect yourself. But some of the other things are, you can go a little stir crazy staying in the house as much as folks have. So stay connected, you know, FaceTime someone, pick up the phone. I know my kids say that's old fashioned, but pick up the phone and just have a conversation with someone. You know, binge watch something really great on Netflix. I know at my house, I have 2 girls and my husband, we have these crazy dance parties at night. Just be careful. At my age, you could throw a hip out pretty easily, but
me too.
Yeah, try to create
I just don't have the moves like I used to, you know, so who knows?
Yeah, exactly. Mine weren't too bad. But honestly, it's, you know, life is what you make it. And while we are all going through this, you can try to have, make the most of a not so great situation so that we can help each other get to the other side.
Yeah, my brother, who's a surgical oncologist, he was on the show last week from Emory giving his perspective, and you know, kind of an interesting situation because you have a governor, just like we were talking about with Governor Baker and Governor Cuomo, about being a little concerned about, you know, going back to normal with especially with regards to the economy too quickly. And there's some places throughout the nation that there's counties that are sheltering in place or stay-at-home orders, and a state that isn't. So Georgia, the governor just made an announcement that he wanted to sort of loosen the restrictions and move back to sort of normalcy of the economy. And then my brother, thank goodness, lives in Atlanta, where Emory is, and their county and their mayor is sheltering in place. So it's a confusing time as well, I think, for everybody, not just the medical profession, who's, you know, a hospital dealing with such a diverse kind of geography.
So we're very fortunate in some ways that in Middlesex County, we have the highest number of COVID positive cases, but the lowest number of hospitalizations. And I want to commend everyone who's listening today, because that just shows you're doing your job. you're social distancing, you're, protecting yourself when you go out, and you're making it safe, not just for yourself and your family, but your neighbors and your friends. And the way we'll flatten this curve is if everyone does that. And it's better to have this go a little longer in the short run so that we don't have a biphasic curve to this, meaning that we all jump starting the economy, and then 6 weeks into this, we have an even higher number of cases. So I truly believe our governor and our current legislators are doing the right things and how they're guiding our state. We are considered a hotspot state, so that means that we're have a high number of cases now, and we're all very vulnerable. So I think following the guidelines, has really worked for us, and I think will benefit in the long term. And everyone can do their part. I know in Concord we have Fuel the Fight, and a number of funds were raised, and we're bringing in food for our staff as well as helping the local restaurants. So I do think that there's some things we can do to help keep the small businesses going. And I want to thank you and your delegation for everything you're doing to help those small business owners, and also the hospitals. Many of us are closed to elective surgeries, and while it's hard on us financially, we know it's the right thing to do. But in the end, we're going to need your help to help us keep operating.
Yeah, that was that was actually one of my questions to you. Have you experienced layoffs and sort of a big hit in revenue? I know LGH has, when it came to not conducting elective surgeries. Is how much of a hit has that been for you guys?
So the president and CEO there, Jody White, and I are very close. We are on the MHA board together,
Sure.
and we collaborate on this. For Emerson, 75% of the revenue we receive is from outpatient, because if you step back and think, the healthcare industry has we've been asked over the last 15 years to push as much as we can to outpatient or ambulatory and do less things in the hospital, and we've done that. In a situation like this, we're losing 75% of our revenue every week. In fact, every day that we're open. So that's been difficult. We've not laid off anyone. We've furloughed folks. So in areas like rehab services where we don't have patients coming in, we have those staff in a standby status and in a labor pool. So we've been able to pull some folks in to help in different capacities throughout the hospital. And it's our intention of bringing everyone back once the hospital reopens.
Well, this has been a kind of an interesting week. I posted on Facebook to my Facebook friends out there, and I think a lot of people have seen it, is the megastar Steve Carell grew up in Acton, and his mom was a nurse at Emerson for his whole life, life as a young child, or a teenager rather, growing up in Concord, Acton rather. Jamie Eldridge made sure that I said Acton, not Concord. But he had a great message, supporting all the work that you guys do there. And you and I were texting earlier. We're trying to get Chris Evans, or as we'd say, Captain America, to come by and give some words of wisdom as well, right?
So first, we're so grateful to Steve Carell. He reached out to us, and not only did he send that very encouraging message to our staff, but he also donated N95 masks to Emerson. And we are so grateful that, he remembered us. And let's be honest, everyone loves The Office, and he's a crowd favorite.
Yeah.
This past fall, Captain America, in his new film, Defending Jacob, filmed one of the scenes at Emerson Hospital. So
oh, wow.
We're really excited for that film to come out, because we are looking forward to seeing the hospital. And we've been trying to get him to send our staff a message too, because as you can imagine, he grew up in Sudbury, was in the Concord Youth Theater, and he's another crowd favorite here. So maybe
his mother runs a theater program in Concord. Yes. Is that correct?
A very, very highly regarded, the Concord Youth Theater.
Okay.
So, again, we're kind of keeping our fingers crossed that he may send us a message in the upcoming weeks. And, but it's really great when you have, major celebrities that are across the country recognizing the work of our frontline staff and the great things that they do every day. Yesterday, we had our first patient. We have now something called Code Happy, and it's the Happy Song by Pharrell Williams. And our corridors were lined with our staff clapping and for a COVID positive patient who was being discharged. And our staff is so supportive of everything that goes on here. And they're able to do that because of the graciousness of the community. I can't tell you, there's a big sign leaving our driveway that says thank you to the healthcare heroes by the Rotary Club of Concord. Last Friday, we had pots and pans and every imaginable noise-making thing, giving a big parade and thank you to our staff. We have a gratefulness board where people come by and post messages. I've woken up and a few times on my front door, I had 12 bottles of distilled water, a big 10-pound jar of candy to bring into our staff. So it's been very, very sobering and very heartfelt for us to see how much the community appreciates what we do.
Well, I'll tell you, that's you know, one of the more famous individuals you didn't mention that was born in Emerson, and his daughter was me. And so I was born in 1974 at Emerson. My mom was a nurse. My wife was a nurse at AFA for a while at Emerson for about 2 years. And my daughter Angelina was born there 4 years ago.
So my challenge to you then is I would love for you to do a video with your wife and your daughter. And if you send it to me, then we'll be happy to send it out to all our staff and our corporators. It's actually a great way for our community to know how much you care. You do a lot of your work behind the scenes, but I know how deeply between Emerson and Lowell General, how much you support the healthcare workers. So I'm putting a challenge out to you. Who needs Captain America? Who needs Steve Carell when we have you?
Oh, thank you. Thank you. You're too kind. Well, listen, I want to thank you for your perspective, your work, the work of your staff. I always hear nothing but high remarks for the work that you guys do there and how you've handled this the last 45 days. It's going to be a little bit longer. Is there a message that you'd like to give back to the folks that watch this video before we sign off?
Thank you so much for your generosity and how you've supported our frontline staff. It means so much to us. And please know we're here for you. Be safe and do all the things I mentioned earlier to keep yourself safe. And we look forward to seeing you on the other side.
Thank you so much, President Christine Schuster. I appreciate you coming in and giving your perspective for the constituents of the 2nd Middlesex District and people on social media who are going to tune into this. I appreciate our partnership and your work and your staff's work. And thank you very much for being on my show today.
Thank you so much.
Thank you.
Bye now.
I'm going to be signing off as well. State Representative Jim Arcero on my shows. I'm taping each and every week with perspectives of people out in the field dealing with COVID-19 virus and how we can share resources and get through this together. Thank you.